Hi there everybody and welcome back to my channel. Today I will be talking about vitreous floaters. What are vitreous floaters? If you want to learn more about this, then please stay tuned. So, inside the back of our eyes, we have a blob of jelly essentially, which you can see from this diagram, and this blob of jelly occupies the largest volume in terms of the eyeball itself. Behind the jelly is the retina. Now, what can happen to us in our early years is that the jelly and pieces of the jelly can start breaking away from the main jelly ball itself. When these small pieces of jelly start to break away and break off, we notice them as floaters in our vision. Now, floaters are visible at certain times more than others. So that may be, for example, if one is looking at a plain white background. It may be if one is looking at the sky, for example. And it also can be more visible if one is actively concentrating and looking out for them, which may sound silly, but it does happen. As we get older, we know that the jelly inside our eye gradually starts to turn to liquid, and we do notice that there can be an increase in floaters as we get older anyway. The importance of floaters and what one should be aware of is the fact that if there is a sudden increase in floaters, or in addition to floaters, other symptoms are noted, such as flashing lights or curtains or shadows coming down over your vision, then it's important to have an assessment done as soon as possible. Because, as I mentioned, the jelly gradually turns to liquid and breaks up over time as we get older. And as part of a normal age-related process, the jelly will come off the back of the eye. The risk with this process occurring is the fact that it can pull on the retina and cause a problem with the retina, which is a lot more serious than the jelly coming off. So floaters are common and they can be present in various different age groups, starting as young as 30, but there isn't really a lower limit at which floaters may be noted by patients. The important thing is to note when they start and whether they're changing and whether they're associated with any of the symptoms, because that is when something may potentially be going on in addition to the floaters, which may need to be investigated and explored further to try and come up with a diagnosis and answer. In terms of floaters then, if you have them, what do you do about them? Well, if they're just floaters associated with no other problems, then over time, patients do become less aware of them, and ultimately the brain will start to ignore the information coming into the brain from the eye regarding the presence of the floaters. But as mentioned earlier, under certain circumstances, such as looking at plain backgrounds, floaters may again become noticeable. So remember, floaters are common. The key thing with floaters is, are they changing and are they associated with the symptoms? Thank you so much for watching this video. If you've liked it, give it a thumbs up. Please click on the subscribe button and please comment. Thank you so much.